Deeks here to discuss about assessment. So Debbie, where do you work and what is your job?
Well, I work at the Alberta Children's Hospital, and I am a nurse clinician in the perinatal follow-up clinic.
Alrighty. What does assessment mean to you?
Well, in my job, in the perinatal follow-up clinic, assessment involves a whole team, and I'm a part of that team. So we assess children who are born extremely premature, and we follow them until they're 5 years of age, and we look at their health, their growth, their development cognitively and physically.
So when you're assessing children in all those aspects, what kind of measurements and such do you use?
Well, as I mentioned, we use a team approach. So depending on the age of the child, we will have certain disciplines come in and see the child at developmentally specific ages. Myself as a nurse, I would assess them at each visit, and I do a screening and find out how they're growing, how they're learning, how they're functioning at home, and if they're in school and in class, how the family is functioning as a unit, if the parents have any behavioral concerns. So that's sort of my part. And then if I feel I need someone else from the team to see the child, I will add that in. So if there's behavior issues, I might add a psychologist in if it's significant enough, or if the child's not talking, I might make sure the speech pathologist would see them. So we function as a team to look at the whole child.
So following assessment, you as a team come up with a game plan as to where the child needs to go and set goals for their development?
Well, we don't specifically set goals, but after we see them, we look at our results, and we, of course, communicate that to the family. And we decide, if anything, do they need any extra help or support in a certain area, and we'll help set that up with the family so that the child can be the best they can be.
There you go, ladies and gentlemen. Assessment in the Children's Hospital. Thank you very much, Debbie and Sue Deeks.
You're welcome.
Just as Debbie had explained, assessment is an evaluation or measurement of how a child performs or acts regarding specific abilities. And as a team, we develop plans that allow students or children to achieve a higher standard of learning and life. One can see the similarities of assessment in the fields of education and healthcare.